Well, it's time to talk more about the pandemic, and yes, it's still here. Our COVID numbers are not good. And joining us today, she is the Director of Prevention and Health Promotion Services at Allen County Public Health, Tami Gough, and thanks for joining us.
Absolutely, thank you.
Okay, so, we'd like to think things are better. We've got the vaccine, but really, we're at a point where this pandemic's really hitting our area hard now, isn't it?
It is hitting us very hard. November was our third highest month for cases that we've had since the pandemic, and we are currently on a pace in December to surpass that and perhaps even reach our worst month.
Wow, and I mean, I don't want to say it's fascinating, but it's so wild because we do have the vaccine now, so you would think things would be getting better.
Yes, last year at this time, the vaccine was just released. We were waiting with bated breath to see how it would trickle into our community and when people could get it. Well, we do have it now, and it has been around long enough that some of the early concerns over the newness of it should hopefully be evaporating.
Mm-hmm. So let's talk about the numbers. I mean, what are the numbers like here in our area?
Just this past week, we've had 500 new cases. With the vaccines and with breakthrough cases, and then what they are anticipating is coming with the Omicron variant, the number of cases is only important because as it gets higher and higher, serious illness and hospitalizations are also going to increase. So the vaccine is so important to get to keep you from having a serious illness should you become infected. But just because the numbers are going to increase so much, whether you're vaccinated or not, there's still going to be increasing hospitalizations in a system that's already tremendously overwhelmed.
Yeah, let's talk about that because the governor made an announcement today that the hospitals are overwhelmed and he's trying to get some help out there. Absolutely.
Just about an hour ago, the governor announced that he has called out the National Guard, over 1,000 troops to assist in hospitals across the state, particularly right now in the northern part of the state.
Wow. I mean, that's truly amazing to hear that, we have to call out the National Guard to help with that.
Mm-hmm. Yes, it is. It's an indication of just how overwhelmed our healthcare system is.
Mm-hmm. Now, the hospitalizations locally, are they mainly unvaccinated people? And, what's the ICU units look like in our area?
Yes, we hear it nationally and across the state, but even here locally, our hospitals have stated that they fully believe that 85 to 90% of the hospitalizations are unvaccinated. So it just speaks to how important it is to take advantage of that tool of the vaccine.
All right, so let's encourage people to do that. Where is the easiest way? How is the easiest way to get a vaccine locally?
Allen County Public Health is still offering vaccine clinics at the former Elder Bierman store in the Lima Mall. We are doing those on Mondays and Fridays from 9 to 3 for adults. You can get your booster if you're eligible. You can get your first dose, your second dose. You can even get flu shots at those. And then also on Wednesday afternoons from 2 p.m. to 5 p.m., we're doing pediatric because 5 to 11-year-olds are now eligible for the Pfizer vaccine. So we encourage appointments. Get the shot.coronavirus.ohio.gov. But we also take walk-ins for those as well, up to a half hour before the end of the clinic.
Mm-hmm. We're coming up on the holidays, and everybody wants to get together, and it's all ages getting together. I mean, what's the advice? What should we be doing?
This is real important when you decide, what can I do? If you've decided that the vaccine is not for you, there are still other things you can do. Masking is still important and is still a help. We're 6 feet apart, so I took mine off. But if you're going to be around people that you are not normally around the holidays, you should put on a mask and protect yourself, whether you're vaccinated or not. You can still carry the virus. You can still spread the virus. Use that tool. Another tool, there are plenty of home tests that are available now. You can pick these up at the libraries. You can buy them at pharmacies. It's good to know your status so that when you are going to go visit relatives or go to a party or get together, you know in advance if you are contagious or not.
Mm-hmm. Let's talk a little bit more about masks because I think last winter there was so much proof that these work because flu cases were down. Less people had colds and things like that. I mean, even if you're vaccinated, probably just still wear them at the stores and when you're out and about. I mean, not just close and confined things with the family.
Yes, absolutely. Whether you're vaccinated or not, a mask will prevent you from spreading the virus if you have it. And again, another thing of thinking about what can you do if masking, for whatever reason, is not for you. Let other people do them without making them feel that they're being too cautious. We want everyone to wear a mask when they're indoors, outdoors if you're in a crowded area. But if you're not going to, just let those alone that are.
And since we are inside more, I mean, still the basics like wash your hands and use sanitizer and that kind of thing. I mean, just get your sleep, all those kind of things, just really we got to do right now.
Yes, absolutely. And I think what's really important is that there will be people who will not mask and who will not get vaccinated. And then we know there are other people at the far end of the spectrum who are very concerned and who do absolutely everything they can. There's a lot of people in the middle, though, that are on the fence. And there's this sense of invincibility that they think is not going to happen to them. They hear the horror stories and they are upset about the horror stories about people who lose parents and grandparents, but they think it's not going to happen to them. Well, the numbers are getting big enough that COVID is going to impact everyone. And with the Omicron variant coming, it's only going to get worse before it gets better. So it will impact you, and you need to do whatever you can do.
Yeah, it is one of those things I think that people are like, it's not going to be me or my family, and you know, things like, you know, cancer and stuff like that. You think that too, but almost everybody is affected by it at some time, and so you really think COVID's going to hit us all like that too.
Yeah. So if you're debating, you know, if you're not completely against the measures, go do something about it. Get the vaccine and mask up.
All right, very good. Well, Tami, thank you very much for coming today.
Thank you.
All right, don't go away. We'll look at medical news next.